Namaste. We come across many couples who are planning for conception, and diabetes is commonly seen in either of the partners. Either the male or the female partner is affected with diabetes. They have high sugar levels, uncontrolled sugar levels, and also it's seen that both the partners are diabetic. So let's understand how to go ahead if you're planning for a child, or if you're planning with your pregnancy, and if both the partners or either of the partner is diabetic, what precautions need to be taken. What happens if you have uncontrolled sugar levels or uncontrolled HbA1c, and still if you conceive, what are the further said complications, and what all do's and don'ts need to be taken care of. So talking about women, if a woman is diabetic and is on certain supplements, whatever supplements you're consuming, and still your sugar levels are not controlled, then first thing and the most important thing that you need to emphasize on is your normal sugar levels. With the help of supplements, with the help of dietary lifestyle regime, whatever help you're taking, but these levels need to be mandatorily normalized before even thinking about planning for a child or planning for your pregnancy. See, if you plan your pregnancy or if you conceive with uncontrolled sugar levels or high sugar levels, you may see certain complications during your pregnancy. So if you conceive with high sugar levels, according to Ayurveda, it's said that it has a direct impact on the bija, that's the sperm or ovum, and it can affect or it can impact the genetic or the DNA level of the ovum or sperm respectively. So in case you conceive with high sugar levels or uncontrolled levels, you get to see structural or genetical abnormalities in the fetus. Apart from that, various congenital abnormalities or heart conditions can be seen. Neural tube defect, or say the spinal cord defect or the brain defect, is also seen in some cases, and the chances of cesarean section may increase if you conceive with high sugar levels. So make sure that your sugar levels are normalized. Apart from that, make sure you're checking your renal function, that's your kidney function test, serum urea or serum creatinine. These investigations has to be done. If they are absolutely normal, if your sugar levels, fasting PP is normal, if your HbA1c is between 6 to 6.5 or below than that, you are absolutely good to go to plan a pregnancy or plan a child, and you can see least complications further ahead in your pregnancy. Now talking about men, so if the male partner is affected, is diabetic, and if the sugar levels are not controlled, if the fasting PP is high, if your HbA1c is uncontrolled, then you may see certain issues when it comes to conception or preconception issues. So in men also, it's seen very commonly in the early 30s or 40s, they come across high sugar levels, and if you are consuming any kind of supplements, make sure the sugar levels are normalized before conception. Just now, as I said, in women also, your sugar levels need to be mandatorily in control, under control before conception, and let's understand why. So most commonly seen condition in men with high sugar levels is ED, that is erectile dysfunction. What happens is when the sugar levels increase or they are high, this functional defect is seen, and the high sugar levels basically affect the nervine control of these organs of the reproductive system, and it leads to unsatisfactory or failure in proper intercourse, and leading to further failure of pregnancy. Apart from that, certain genetic DNA level abnormalities may rise with high sugar levels in men, and certain infections in the male genital tract, like or the testicles or the prostatic area, are also seen due to uncontrolled sugar levels. And if the sugar levels remain uncontrolled, further it may lead to semen defects, leading to reduced motility or reduced viability of the sperms. According to Ayurveda, the bija, the seed, the sperm, has to be in a good shape. It should be with utmost of good quality, devoid of any abnormalities, and it should be in good shape with regards to motility, mobility, viability, or the morphological, that's the structural formation of the sperm. If that's not good, the embryo form may not be good, or may have certain defects, may fail with the implantation, or it can lead to certain genetical or structural anomalies in the child born post delivery. Or also you can see chances of preterm labor in most of the cases. In most of the females, we get to see higher incidences of miscarriages as well. So in many cases with miscarriages, with a history of miscarriages, either of the partner, the male partner, is seen diabetic. Apart from that, we also get to see abnormalities in the DNA fragmentation index. So if your sugar is uncontrolled, and when we check the DNA fragmentation index of the sperm, of the semen, we get to see that it's high, it's affected, and this affects further with the sperm fertilization potential ability, which is affected significantly. Hence, your sugar levels need to be in control. And apart from that, the testicles are majorly affected in men if you have high sugar levels, and eventually affecting the sperm forming capacity as well. So it's very, very important to have normal sugar levels. So say your fasting sugar levels should be around 110, your PP, that's your postprandial, should be less than 150, and HbA1c should be between 6 to 6.5 or below 7%. So it's very, very important to have controlled sugar levels, controlled fasting PP and your HbA1c levels, and then it's a green signal, you can say, and you can go ahead and plan for conception, plan for a pregnancy. Unless and until the sugar levels are not normal, please do not go ahead with conception, because you may come across certain complications ahead. So according to Ayurveda, what to do, how can you balance your sugar levels? So most importantly, the preconception ritual is explained by Ayurveda if either of the partner or both the partners are diabetic or have uncontrolled sugar levels. So most importantly, Ayurveda explains the importance of various set of Panchkarmas. It is also called as Bija Shuddhi. Bija means seed, that's the Shuddhi means detoxification in a vague term, but it's beyond that. It helps balance your bodily dosha, dhatu, and apart from that, whatever is imbalanced, if the sugar levels are imbalanced and other things which are imbalanced in the body, all this is balanced well. So that's a preconception ritual followed by Ayurveda and explained by Ayurveda. In this, a various set of Panchkarmas like Vaman, Virechan, Basti, Nasyam, Shirodhara, Uttar Basti is planned step by step to both the partners, so that the bija, the seed or the sperm and ovum in men and women respectively is devoid of any abnormalities, and there are corrections that may happen at the genetic and the DNA level as well. Apart from that, a dietary level, dietary correction and a lifestyle correction has to be mandatorily followed. Start consuming dinners before sunset. That's the basic correction and the most important correction that has to be done by both the partners. So if you want your sugar levels to normalize, and apart from that, all the other genetic factors and the DNA level corrections to happen, make sure you're consuming your last meal of the day, that's the dinner, before sunset. Do not consume anything after sunset or late at night. Try sleeping early. Try to balance your lifestyle. Sleep by 10:30 at night maximum, and wake up by 5:30 to 6 a.m. in the morning. Try to do some form of physical activities or exercises on a daily basis. It could be walking, or yoga is the best form of exercise. Walking is also good, or swimming, whatever suits you and according to your lifestyle and your strength and stamina and energy levels, but start with certain form of exercises. Apart from that, apart from whatever medications or supplements you're taking, it could be allopathic or it could be Ayurvedic, continue with all those medications and make sure you're following a balanced dietary and a lifestyle regime, so that your sugar levels will be normalized. And along with that, Ayurveda recommends a set of Panchkarma and a proper dietary regime, so that your sugar levels will be normalized. And apart from that, if you have any other problems or any other issues or any other symptoms related to that, those are also parallelly resolved. And so that's a preconception ritual. It's almost a 2 to 3 months course of treatment, because it takes time. If you have uncontrolled sugar levels, just few weeks of medication or treatment or lifestyle corrections will not help you. You need to wait for at least 2 to 3 months. In both the partners, step by step Panchkarmas are recommended, and we also make sure that we are keeping a track on your sugar levels parallelly, and other factors also. If certain factors in your investigative factors are abnormal, those factors are also taken into consideration. But talking about sugar levels for now, so sugar levels we make sure that the sugar levels are normalized by following a particular medicinal supplementation along with a proper dietary and lifestyle regime. And Panchakarma, of course, wonderfully helps when it comes to correcting the bodily doshas and dhatu and the certain imbalances. So make sure, if you are diabetic and if you're planning for a child, wait, go slow, start with correcting your lifestyle and dietary regime. Make sure your sugar levels are absolutely normal, because you don't want any complications during your pregnancy or after delivery as well. Because if you are following certain things now, you will have least complications, and your child born will be absolutely healthy, devoid of any abnormalities, and will not have any kind of genetical ailments passed on to him in his future life. So go slow and plan your pregnancy accordingly.